Whew, okay, so I am thrilled to have our three esteemed panelists here with us. We will be talking a little bit just around how is what is happening right now impacting their work, how could it impact their work, and most importantly, I want us to all feel equipped with how can we help? How can we have our voice heard so that we can make sure that really critical services are not taken away from our children? So I would like to introduce these panelists. First, I have Dr. Choukri Ben Mamoun. He is the John F. Enders Professor of Medicine and Infectious Diseases and Vice Chief of Infectious Diseases at Yale University and a leader in rare disease drug discovery. His lab develops small molecule therapies for BCAN, one of the most common MBIA disorders. Excuse me, supported by the MBIA Disorders Association. His work helped launch Virtus Therapeutics, a biotech company advancing targeted treatments for MBIA. We also have Dr. Laura Adang. She is a pediatric neurologist and physician scientist at the Children's Hospital of Philadelphia. She leads CHOP's WDR45 and Related Disorders Clinic, an MBIA Center of Excellence. Had to, providing coordinated care for individuals with BPAN and other MBIA disorders while advancing research towards future treatments. And then we have our special guest, Anna Maria Connor, who is an attorney and a disability rights advocate from South Carolina. Her work focuses on protecting access to services like Medicaid and promoting policies that support people with disabilities. She brings a strong community voice and a deep commitment to empowering rare disease families. Thank you for being here. All right, so I have a few prepared questions, and if we have time, I will open up for the group. But let's start with, these decisions that are happening for healthcare, disability services, education, research, they're going to shape the future for families like ours. How is your work being affected by these shifting policies? And maybe a little bit on why is it just so important for our families to stay engaged and informed, no matter what their personal politics?
Okay, gee, the attorney goes first. Scary. First of all, I think there's a lot of confusion out there. And there's always difficulty from my point of view, especially if you're first-time families, coming in and understanding what your child needs, what services are available, and things like that. It doesn't become easier in some ways over time. At the other end of that, though, you do learn. You become a better advocate because you learn the system and you make connections. Right now, with a lot of employees being lost, being moved around, things like that, there's a lot of confusion within federal government as well as state government. Here in South Carolina, we're also reorganizing the two main services agencies that serve kids with developmental disabilities and related disabilities and mental illness. So that makes it more confusing on top of the federal confusion. So that's an issue. Possible cuts to funding and Medicaid and things like that, and depending upon how deep those cuts are, again, that could affect what services y'all are able to get. Can you get community services versus going into a facility and things like that? So there's lots of layers to that.
I'm Laura Adang. I'm at Children's Hospital of Philadelphia, and I'm an NIH-funded physician scientist. This is profoundly affecting our ability to serve our families. And I mean that both in a clinical sense, but I also mean it in terms of how we're going to help our families in the future. But I would like to both begin and then ultimately end this conversation with one of hope. This is a time for us to be resilient and join together as a community. This is not a time for us to feel panicked and overwhelmed that all is lost, because it isn't. Each of the people in this room has faced things that they never thought that they could handle. And they have come together as a community and as a force to change the world. We're just going to have to be adaptable and pivot a lot. Because I don't know where we need to be in a year from now because the sands are shifting. But this is the time we need community advocacy, we need community fundraising. We need to make sure that we don't lose the next generation of scientists, that we have funds to help keep labs open. And it is really uncomfortable as a physician asking for help, but I am saying as part of this medical scientist infrastructure, we need help right now. These are really tough times to be a physician scientist, and if we want to have treatments in the coming years, we're just gonna have to come together as a community, but I know we can do it. It will be okay, but it will be okay with a lot of hard work. I think one of the moments of hope that I had is I have been working for years to get another rare disease, metachromatic leukodystrophy, added to newborn screening. And this was something that we had worked together as a community, strategically getting ready that within weeks of gene therapy being approved, we were going to petition to get it added to the federal panel. We did so. It was successful. It was hundreds of pages that we did as volunteers putting together. We even wrote papers and got them peer reviewed for the sole purpose of being part of this package. It went to unanimous approval of the Committee before Evidence Review, and it was set to be reviewed by the panel, and their final vote was to happen on May 8th. The panel was disbanded 2 weeks prior. And so we have no way to add new newborn screening tests at the federal review level. And so as a community, were we sad? Yup. Were we disheartened? Yup. Did we stop? Nope. We all flew in on May 8th, and we spent 2 days meeting with our congresspeople, our senators, holding congressional hearings on the importance of nonpartisan newborn screening, and it's starting to make a change, right? And so, was it the easiest path? No, that's okay. This is a room filled with resilient, strong, powerful people. We can do this. We just have to be adaptable and work a little bit harder to get there.
Yeah, good afternoon. So to add to what my colleagues just said, I would like to emphasize something that's probably not often discussed in these forums, and that is, what do we do as scientists? So we look at us as people who may be able to help solve this problem, but really our primary function as scientists is to solve problems. We are problem solvers. And we do it because we can spend a huge amount of time thinking about the problem, try to figure out the source and the mechanisms behind that problem, and try to solve it. That's what we spend our time on. People tell me, how many hours do you spend doing science? I tell them, all of them. But really, that's what I spend all my time. If I wake up at 2 in the morning, I'm thinking science. If I wake up at 3 in the morning, I'm doing the same thing. Unfortunately, after 25 years running a research lab, I've never experienced anything like what we have experienced this year. And we experience from different angles, as a researcher, as a mentor, and also as an entrepreneur. We are losing people in science. And this is a big problem, because many of us who work in this country or came to this country came because this was the country of excellence. This is a country where we strive for excellence, for leadership, for bringing the best medication to the patients, to help those people who are affected by various diseases. Unfortunately, we are now finding ourselves in a battle that we were not prepared for. Instead of focusing on science, on solving those problems, now we are trying to figure out, is my funding going to go away? Am I able to support our students, postdoctoral fellows, the clinicians we work with? That's what I spend my day thinking about. We have had students who were promised funding to continue research on NBIA. And the funding was coming, went to meetings and everything else was signed. And then we told that no longer exists. Absolutely outstanding students, absolutely outstanding postdoctoral fellows who have now decided to leave the field of science because that funding doesn't exist anymore. So those are the issues that we are facing currently. Hopefully there will be a solution in the coming years, but what we are going to lose is the momentum that we built over the years to ensure that what we do advances so that one day the patient can find a relief, that there are treatments that will help them improve their life and that of their parents and their caregivers.
Well said, all of you. So I'm going to double click us a little bit because I think there are probably families out here saying, but what are the other, like, what does all of this mean? What is the impact? So if you all could tell us a little bit about, what are the most important programs or funding sources that are supporting MBIA research beyond, NIH is a very well-known, but there are other ways that this is being funded. And then maybe the second is, how are those proposed policies starting to be very concerning and impacting you?
So I can tell you, in our case, NIH is our primary source of funding. We also talk to a lot of investors and foundations. Foundations are not getting enough donations right now. Investors find the rare disease field to be not profitable, but still want to do it from a philanthropic reasons, and that also has been affected by these issues. And then finally, NIH is really a big issue. For those of you who don't know how the NIH process works, we submit grants for specific deadlines. Those grants get reviewed, they get scored, and then they get the decision to fund them or not to fund them is based on what we refer to as the pay line, or a score that you get. If you're below the pay line, you get funded. If you're not below that pay line, you might not get funded. That pay line has dropped significantly now, that out of maybe 100 applications, maybe 5 or 6 will get funded. And you have to think that the next 6 to 30 are outstanding applications, are amazing applications that will not get funded, and that research will stop. So at least from the NIH standpoint, with all these cuts that we are seeing, a lot of science is being damaged. And if those grants are not funded, that means the individuals who are supposed to be paid to do that research can no longer get paid. And they will have to find a job because they are like us. They have to pay a mortgage. They have to send their kids to daycare. They have to pay for the car, for every daily stuff. And when there is no funding, the first thing they do is they start sending applications to all kinds of fields to find a job. What we are seeing right now, 2 trends that we are seeing, and that really heartbreaking stuff to see. One is we are seeing students and postdoctoral fellows, brilliant scientists who devoted a lot of years of their life to research, are leaving the country. They're applying already to go to England, to France, Germany, other places. That's going to have a major impact. And second one is those who are staying here are leaving science, going to Wall Street, going to start their own businesses or to teach on other aspects. Not that those are not good jobs, they are very important jobs, but we have invested a huge amount of time and energy in training this next generation of scientists that we are losing right now. And that's going to have a major impact down the road. It will affect also our position as a leading scientific country around the world. And it's really something that we need to change quickly, otherwise the impact will be dramatic.
Yes, I mean, I agree with it all. I mean, I think we're at the very beginning phase, but we won't know what the effects are for decades. And also, we will never know of the cures that we don't find, right? And that's, I think, the part that makes me lose sleep at night, is I can tell you immediately which grants are not getting funded, which projects are not moving forward, but I don't know where I would have been in 5 years or 10 years if we had allowed to continue on this momentum. It's a big deal. The faster we can get science funding reinstated, the smaller the damage is going to be, because I agree, we're having a huge brain drain. Even professors are starting to leave at this point. It isn't a sustainable system if you can't get funding to do your research normally we have, as was mentioned, 3 arms that help us fund research. The highest level and kind of the most prestigious is NIH funding. So the higher percentage of NIH funding you have, the higher quality caliber, kind of like nationally approved research group you had. And then you also use industry funds, which, as was mentioned, industry is starting to think that they can't make money from rare diseases. So they've been pulling out for years. And then you have philanthropy. And I think with the changes, there's a lot of contraction of philanthropy and philanthropic options right now, too. So it's kind of all legs of the stool are being cut. I'm sorry, this is a really
we're going to go back up.
doomsday session.
You know, but I think it is a doomsday session, but we have to have this conversation. So, you know, we'll have much more fun ones next, but this is an important conversation for us to have so that we can do something about it, because we are a powerful group and we can move mountains together. Anna Maria, I'm gonna send this one to you. Can you talk to us a bit about like changes in healthcare, education, disability services? What should families be watching? And how can they stay most informed so that they can advocate, especially when this system feels very overwhelming?
Okay, a lot of the things you've heard about already, the loss of funding or the loss of respect for certain agencies. In the Medicaid field, for instance, and a lot of the work that we do, we're federally funded. All the P&As across the country are. But we also have special funding that comes from certain agencies that are now or divisions of agencies that are going away. The Administration for Community Living, which was the division under Health and Human Services, they provide a lot of funding not only to us, but to Family Connection, the ARC, and other things, the DD councils. All of that whole ACL unit is being eliminated and moved over. So again, they're losing employees. So who's going to be responsive to your questions? So we're going to have to figure out who's doing what at the federal level in all of these different divisions. Who understands Medicaid? Who can answer my question about qualifying for Medicaid or services under a Medicaid waiver? Or most of you have children under the age of 21, so you're entitled to a special part of Medicaid just for kids called EPSDT. How many of you guys know about that? Okay, basically Medicaid defines a child as 21. So if you're a Medicaid eligible child, you're entitled to services just because you're a child, and it lasts till the age of 21. So you don't have to worry about a waiver, you don't have to worry about other special things, as long as you're Medicaid eligible. And what this whole program does is called Early Periodic Screening, Diagnostic, and Treatment. So it's the part of Medicaid that requires that your child get a screening at least once a year. You can get additional screenings if you need them, but you have to have at least once a year screening for health and conditions and improvements. And then once you have a diagnosis from that screening, it requires Medicaid to actually provide the services, the therapies, the treatment that are recommended by the medical professionals for your child. And it says Medicaid must do this. So, you know, that's a big section of Medicaid. So how many of those Medicaid workers who understood EPSDT are still there? And who do you call? Who do I call? There are attorneys that were working with us on community cases. All 3 of those attorneys are gone now at the Department of Justice. So we actually had a class action lawsuit that they were suing the state of South Carolina over some services for adults. All 3 of the attorneys that have worked on the case that came down here a few years ago and took our work and then built on it and investigated that across the state, they're all gone. There are attorneys that are still there that are taking over the case. In Department of Education, again, they're trying to eliminate the Department of Education altogether. So those of you who have your kids in school, that's going to affect enforcement of the IDEA. It's going to affect if they eliminate or downsize too much. Again, what are you going to do about educational questions? In South Carolina, our State Department of Ed is good, but they don't have authority to make school districts do certain things or to do anything. They have very limited authority. So we often file complaints with OCR, Office of Civil Rights, in the Federal Department of Ed to get things enforced. It took a while, but they understood IDEA, they understood 504 of the Rehab Act that provided protections for kids in school. And again, if the federal department goes away or if they're too small, they won't be able to do that work. I do know that in other services, for instance, like in Social Security, one of the reasons why probably applications for disability determinations are even slower. Here in South Carolina, it takes at least a year for almost anybody to get determined disabled from Social Security. Some people are being told it could be 2 to 5, 7 years maybe before their application is processed. That's all a problem, but it's going to be worse because they're also eliminating and consolidated some of the regional offices. So even though they're not eliminating the processes, they're eliminating a number of workers. So now when you had an office in Charlotte and an office in Atlanta that covered and shared work for that region, now you have maybe an office in Atlanta. And you have the same number of employees who worked in Atlanta. You don't shift people over from Charlotte. So the downsizing, that's kind of a cumulative effect. So that's Medicaid, that's school services. There's just a lot of different things that are being affected. I think, again, vaccines, the announcement that COVID is not going to be on the schedule, that's always a concern because you want your kids to be able to access all the vaccines that you want them to have. And if your child needs a COVID vaccine before they go back to school, will Medicaid pay for it? Will your private insurer pay for it? You don't know because it's not on the approved list anymore. So there's just a number of different things I think we're going to have to address.
All right, Laura and Anna Maria, coming right back to you. Can you talk about some of the realistic ways that our families can engage with lawmakers and policymakers on research, on disability, especially in the context of, for families, it can feel intimidating or overwhelming to even, know where to start and then have the courage to stand up and have that. So we'd just really love to hear from you all. How can we make advocacy more personal and approachable?
I love that. We need you guys. Your voices are much, much louder than ours are. And so you have stories to tell, you have children to protect, and this is such an important moment to use those voices, right? I think you can do it at the state level, and I think part of the problem is not shifting federal power to the states. It wasn't that it wasn't transitioned. Does that make sense? Yes, certainly the states can pick up some of this. So talk to your state representatives and say, hey, these are the gaps that we have. I'm worried about getting my IEP followed. I'm worried about how I'm going to get my Medicaid. I'm worried about all this secondary coverage or getting services. Take it to the state level. Force them to build those services within your state. And I've done most of my advocacy work at the federal level, but you can also go to that level too, right? Talk to your state representatives and your senators. I think there is a momentum and a moment right now where people are going, oh, these are cuts that are affecting children and Americans, and they have catastrophic effects that weren't even anticipated. Let them know. And don't let them know once, let them know many times. It is the squeaky wheel that is going to be listened to. You also will likely have to tell a lot of people because ultimately you actually only need one person to take on your cause as their cause. And then that person will help to galvanize and lead forward, right? Of the people we met on the Hill, I need just one person to decide that MLD newborn screening and newborn screening is a cause that's important to them because they know someone whose life was changed through newborn screening, right? We need one person to care. And then that one person we will get behind and help bring that passion forward. And we will, each one of us have a cause that's different, right? For my children in clinic, I care about Medicaid, and I care about IEPs, and I care about services, and I care about research. But sometimes you just choose that one thing, right? I chose this month to focus on supporting newborn screening. And maybe next month I'll have the bandwidth to add something in. And I tell you to do the same thing too. Don't save the NIH. Don't save Medicare. It's too big. Save one small little tangible piece and fight for that. And then when you have the bandwidth, add on another little piece. And eventually we will get to a system that hopefully even serves us better. because if I can be truthful, because now is my honest private time, it's always been really broken. You guys had a really hard time getting services. It wasn't easier before. It was just slightly less hard. And so it's okay, we're gonna build this together stronger and better. But we have to do that, and we need to have a voice at the table as it's being rebuilt so that it better serves our community, because it really wasn't doing a great job before.
Yeah, those are great words, and I would just say that the personal stories always matter the most. I mean, I can go in as an attorney, I can assert certain things, I can say, oh, I've got all these clients. Wednesday, Representative Clyburn, who represents Aiken and down in the Low Country here in South Carolina, had a Medicaid roundtable. And we were able to bring in the brother of a client that we served a few years ago to talk about his story. And we were focusing on what's going on with Medicaid, you know, how is it needed? Let's try to show people. His words meant more. So if you can get the time and the courage to start thinking about sharing your personal stories, you know, talk about when your child was born and how you discovered certain things were happening, how he or she were diagnosed, and the things that you had to start going through. That's important because they're important. And there are more people like you than not like you. Some people just don't realize it. So they need to hear from those of you who do have those stories. And I think it's important to start at the local level. Make sure that your state representatives, your state senators do know who you are, that you are their constituent. You vote for them, and you want a little bit of their time, and you want to ask them questions. What is it? What is your stance on these services? What is your stance on funding research that might benefit my child? Because it can happen at the state level. Certainly, Representative Clyburn and other people like him are going to be talking to senators, and he's planning on taking the stories that he's gathering in South Carolina right now to talk to Senator Graham and other senators about the funding bill. The same thing can happen with funding for research or funding for other things. You know, be able to talk with other organizations. The ARC is looking at things. Family Connection is looking at things. There are lots of national organizations. We're a member of National Disability Rights Network. It's our membership group. We have lobbyists up there that are working on issues for us. And Kaiser Family Foundation, there's a group out of North Carolina called InHelp, National Health Law Program, that they specialize in looking at Medicaid and services. They all have toolkits. Everyday Life was something that I learned about this week preparing for this panel. So, you know, there's a lot of different organizations that have information that you can use, and they won't tell you what to say. They will sometimes give you an outline. Like if you want to talk about Medicaid, they'll explain some things, but you can pick and choose what you want to do. The question is, you know, how many things can you work on at once? What's the most important thing at the time? Don't be afraid to shift to it. And, you know, can you take the time to share your story, and where do you want to start? And recognize, too, that once you start sharing your story, other people are going to come to you and ask, can you come talk to my group? Can you come talk to this person over here? So be flexible. But again, you have to make sure that your family comes first, so limit what you can do and make sure you're comfortable with everything, because once everything's out there, it's out there.
Yeah, I would echo Every Life and NORD. Both are rare disease organizations run through kind of national level, and they both have talking points to reach out. And I've also worked with quite a few family organizations that have put together common talking points for the community to give some language that is NBA specific to help share with families that want to get involved. I think just preparing those things, messaging, if your representatives have in-person hours, those always mean a lot more than emails and calls, but let's show them we have a voice, and let's use it for good.
See, we're getting more uplifting. As you two were answering, it occurred to me, artificial intelligence could help us a lot. You know, if you think about, my daughter has NBIA, BPAN, this is my story, this is what I want to communicate. I suspect it can take a lot of that work out for our families. So shout out to ChatGPT for me. Yeah, it does everything for me. It actually wrote this panel. All right. All right, so I want to kind of bring us to a positive ending of this conversation. And in the face of all of these challenges and everything that you have shared, what is it that's giving you hope right now? And how do you think that our families, our researchers, and our advocates can best keep moving forward together with purpose and impact? And Choukri, I'm going to start on the end with you.
I can give, again, the perspective of researcher. I can tell you people in my lab at Yale University as well as at Vertus Therapeutics, Jessica is right here, she will be talking tomorrow, are people who devote their energy, their life, and love for this topic. We have a lot of research projects in my lab, and this one in particular is really one that they care about. I can tell you personally, this was just a serendipitous finding in my lab that we could actually solve this problem potentially for PCAN, because we didn't work on this in this field at all. But from the moment I learned about this disorder, and I met the patients several years ago, I really started losing sleep because it really pushed my energy by 10, 100 times to try to solve this problem. And I can tell you it's the same for my lab members. We meet at least once a week on Thursdays for about 2 hours to talk about the progress that we make. It's frustrating at times because the biology is not very well developed. There are a lot of misconceptions that we have to remove so that we can advance our science forward. But the only thing I can tell you here, since we're all looking forward to positive data, is we're really making progress. I can tell you this for sure. We're making progress. There will be solutions, scientific solutions, in different forms, either small molecules or gene therapy. They will happen. We just need to make sure that these hiccups, these hurdles that we face, like the one we are facing this time, are eliminated so that we can continue to make progress. Because science moves at those incremental changes. But the small changes we make build up, start compounding, and then there is acceleration phase. Once we start solving a lot of small problems, all of a sudden we realize that here is the big picture, and we will solve it. And that's where we are right now. We're really trying to build that momentum, and hopefully this will go away, and people will come to their senses and realize that this is so important for our nation and for the world, and to help the patients. And my hope is really that we can deliver in the coming years something that will help the patients and their families. That's what I hope for. And if it happens, I will retire the next day.
You know, I do think in spite of everything going on, there's a lot of hopeful things happening too. For instance, I can tell you that right now, our state Medicaid agency is applying for what would be a new waiver. It's called a demonstration waiver. And what it would do is it would look at families, caregivers, parents, and let me get this right. Caretakers, relatives, parents of people with disabilities who literally make just a little bit too much money to qualify for Medicaid themselves. But so they find it difficult to choose between working and providing for that family member with a disability or staying at home because they don't have enough services to take care of that person. So this waiver would look at that, and it does have some work requirements in it. But basically, it would open up for about 12,000 individuals across the state who are parents, caregivers, and relatives of people with disabilities who are on Medicaid. It would give them the opportunity to stay at home, provide services, and get Medicaid support. They would get access to state Medicaid services. So that's a big thing. And there's a push, and this started some time ago, there's a real push to recognize how much support and how important caregivers are. So there's a lot of movement across the country to finally start saying we need to pay caregivers, we need to make sure that they get access to Medicaid and other types of insurance, they need to get special consideration. We might need to figure out other things to do for them. But that's actually, again, a wave of something that's coming from several different states, not just South Carolina. So that's a good thing, and I think many of you will be able to benefit from some of those programs going forward. I do think, too, just the fact that so many people are realizing that they rely on special education, or they rely on Section 504 for a reasonable accommodation at work or for educational services, or their parents are on Medicare, Medicaid, and get certain things. Or we didn't realize that this federal agency approved this application, and now nobody knows how to process it because those people with experience are gone. The more people realize that goods and services are being impacted by the changes in the questioning and the loss of experienced employees, the more people are paying attention. And so I think that's always a good thing. People are waking up and they're realizing that they need to pay attention. They need to actually ask questions and find if something is going to affect them or their family members, or if they feel like they should provide more for other people. You know, do they want to support education more? Do they want to support research? And so is there a way they can do that? And they're actually taking action. So I think that whole advocacy mindset is being taught to people across the country. And we're looking at how many different things we didn't understand and that we needed to pay attention to. So that's helpful.
I have hope from the people in this room. I wasn't entirely sure if we'd be talking to 5 people. I mean, I think the fact you guys showed up, you're willing to help enact change, you're willing to hear the problems and help us come up with solutions. You are in a resilient and wonderful and honestly incredibly powerful community. And I am really excited to help work with you to raise voices to make sure that our children and our loved ones get the care they need and the future they deserve. So thank you for showing up. I'm slightly impressed and surprised.
They're here because I'm here. Just kidding. Look, today's conversation, I hope for you, was a reminder that policy and advocacy are not abstract concepts. They are deeply, deeply personal. They influence the pace of research, the quality of care that we can provide to our loved ones, and they are the daily lives of families living with MBIA disorders. If there is one takeaway I can give to you all, it's that you don't have to be an expert to make a difference. Your voice matters. Your loved one matters. And every single action you take, whether it's joining a study, whether it is fundraising, contacting a legislator, or just simply being informed so that you can be ready to have that conversation when the moment arises, it is important, and you have that power. Thank you to our amazing panelists, and to all of you, again, for showing up, for speaking out, and for standing together. We will continue forward, our families, our advocates, and our researchers, because we are all united in one mission, that we are going to end the suffering of NBIA. Thank you for being here.